Eli Lilly's exploration into obesity treatment reveals a surprising twist. Their experimental GLP-1 oral pill has demonstrated the ability to assist patients in shedding an average of 12.4% of their body weight during a late-stage clinical trial. However, this figure falls short of the benchmarks established by Novo Nordisk's injectable medication, Wegovy, resulting in a notable drop in Lilly's stock prices. Despite Lilly's promising results, the company's shares experienced a sharp decline of nearly 15%, marking the most significant one-day decrease in 25 years and wiping out over $100 billion in market capitalization. This downturn had a significant influence on the S&P 500 index, although it remains worth noting that Lilly retains its status as the most valuable healthcare corporation globally. Dave Wagner, a portfolio manager at Aptus Capital Advisors, expressed that the 12.4% weight reduction is still commendable, urging caution against hasty market reactions. He remains optimistic about Lilly's prospects in the weight loss sector. Outperforming expectations is a tough challenge, and Lilly's recent data did not achieve the high standards investors anticipated, allowing shares of Novo to hike by over 6%. "We find these results encouraging," said David Ricks, Lilly's CEO, during a conversation with investors. He emphasized the company's ambition to introduce a powerful GLP-1 treatment in the form of a conveniently administered daily pill, aiming to address the global obesity crisis effectively. According to a Lilly executive, pricing for Orforglipron will consider both its value and the broader economic implications. The company is also committed to offering direct-to-consumer pricing options due to existing gaps in obesity treatment insurance coverage. Morgan Stanley analysts predict that Orforglipron sales might reach up to $40 billion by 2033, particularly benefiting both obesity and diabetes markets. Contrasting with injectable alternatives that replicate the appetite-controlling GLP-1 hormone, Orforglipron is praised for its small molecule formulation, making it simpler to produce and package. Kenneth Custer, president of Lilly's cardiometabolic division, highlighted that they see this oral medication as a viable option not just for serious weight loss cases, but also for prevention strategies and long-term health management. This shift is notably significant, as numerous studies suggest that patients often prefer taking pills over injections due to the discomfort associated with needles. In a comprehensive study involving over 3,000 adults struggling with weight-related health concerns, excluding diabetes, participants receiving the maximum 36 mg dose of Orforglipron reported an average weight loss of 12.4%. In comparison, those who were given a placebo lost merely 0.9%. Additionally, patients on a lower 6 mg dose experienced a weight reduction of about 7.8%. The initial expectations for Orforglipron's success revolved around outperforming Wegovy, which measured at a nearly 15% reduction in a previous trial. Therefore, the outcomes of this study have caught many analysts off guard. Adverse side effects were a concern, as roughly 33.7% of high-dose patients reported experiencing nausea, while about 24% dealt with vomiting. In contrast, these figures were significantly lower for those in the placebo group, measuring at 10.4% and 3.5% respectively. Analysts pointed out that Orforglipron's tolerability could be perceived as comparatively lesser than what previous trials had demonstrated for diabetes patients. While the situation remains under control in their perspective, BMO Capital Markets' Evan Seigerman stated that the observed adverse effects might exceed investor expectations. Approximately 10% of the higher-dose participants withdrew from the study due to side effects, but Lilly reported no safety issues linked to liver health. At least 3 other analysts mirrored the sentiment that Orforglipron's anticipated performance was supposed to match or exceed Wegovy's previous historical data. Lilly's results have prompted some to view Novo's prospects more favorably, with some suggesting that the competitive threat posed by Lilly has lessened significantly. Currently, both Zepbound and Wegovy dominate the weight loss landscape, a market projected to balloon to around $150 billion within the next decade. An FDA review is in progress for a higher-dose oral Wegovy formulation, aiming for approval by the end of this year, also showing promising results for weight reduction among overweight and obese patients, achieving an average of 15%. Lilly's own research indicates that Orforglipron positively impacts heart disease risk markers such as cholesterol, triglycerides, and blood pressure across all administered doses, further bolstering its profile. While Wegovy has received authorization for reducing the risk of significant cardiovascular events, Lilly recently shared insights indicating that their diabetes treatment Mounjaro, featuring a similar key ingredient to Zepbound, exhibits heart protective benefits as well. Such approvals could further enhance the chances of securing insurance coverage for weight loss medications. Earlier this year, Lilly also announced that in a Phase 3 study of Orforglipron, patients with type 2 diabetes lost roughly 8% of their body weight over 40 weeks of treatment. In preparation for a future commercial launch, Lilly has initiated production of Orforglipron, aiming to establish a reserve to mitigate supply shortages that previously occurred due to overwhelming demand for injectable treatments. Comprehensive results from the clinical trial funded by Lilly will be revealed at a prominent European diabetes conference next month, marking a critical point for the company's continued development in this sector.